Most people don't think about their liver. They don't think about their kidneys until something goes wrong. But here's the reality. These organs rarely fail suddenly. They decline quietly. Your liver processes everything you eat. Your kidneys filter nearly 200 liters of fluid every day. They work continuously, silently. And when they are under strain, they don't scream. They whisper. Persistent fatigue, mild swelling, digestive discomfort, changes in urination, brain fog. Nothing dramatic, but not random. Today, we are going to decode the subtle language of your body's filtration system. Because the earlier you recognize the whispers, the easier it is to recalibrate. This is Health Reimagined. And today, we listen to the silent filters. Your liver performs over 500 known functions. It regulates detoxification, hormone metabolism, blood sugar storage, nutrient processing, cholesterol balance, protein synthesis. It is one of the most resilient organs in your body, which is exactly why it is so easy to ignore, because it compensates for a long time. Fatty liver, for example, can develop silently over years. Mild inflammation can persist without pain, and the person feels mostly fine until they don't. The liver does not contain many pain receptors, so early dysfunction rarely causes sharp pain. Instead, you may notice persistent low-energy brain fog, mild right-sided abdominal fullness, bloating after meals, subtle changes in skin clarity, increased sensitivity to alcohol, difficulty tolerating heavy or fatty foods. None of these automatically mean liver disease. But when they cluster, they form a pattern. And patterns are where awareness begins. Modern lifestyle places enormous demand on the liver. Ultra-processed foods, excess sugar, refined carbohydrates, alcohol, environmental toxins, chronic stress hormones. Every one of these increases hepatic workload. When the liver is overloaded, it shifts into fat storage mode. This can begin as mild fat accumulation in liver cells. The person doesn't feel fat accumulation, but they may feel sluggish after meals, energy crashes, persistent fatigue, weight gain around the abdomen. Again, whisper, not crisis. The liver plays a major role in detoxifying metabolic byproducts. When detoxification efficiency decreases slightly, you may experience brain fog, irritability, reduced concentration, mood instability. The liver influences neurotransmitter balance indirectly. It helps regulate inflammatory load, and inflammation affects the brain. So cognitive dullness can sometimes be a metabolic whisper, not just being tired. The skin often reflects liver load. Subtle indicators may include dull skin tone, mild yellowing in severe cases, increased breakouts, itchiness without rash. These are not diagnostic, but the liver and skin are deeply connected via detoxification pathways. If elimination pathways are overwhelmed, the skin sometimes participates. Again, pattern over panic. Your kidneys filter blood continuously. They regulate fluid balance, electrolytes, blood pressure, acid-base balance, waste elimination. They are highly vascular organs. And like the liver, they compensate quietly. Chronic kidney strain develops gradually, often over decades, and early signals are subtle. Possible subtle indicators include increased urination at night, changes in urine color or clarity, mild puffiness around the eyes, swelling in ankles, persistent dull lower back ache, unexplained blood pressure elevation. These symptoms can have many causes, but when they persist, they deserve attention. Kidneys are deeply sensitive to chronic dehydration, high sodium intake, high blood sugar, hypertension, chronic inflammation. The whisper phase often shows up in fluid balance. Many people are chronically mildly dehydrated. Dehydration increases kidney workload. It also thickens blood, raises heart rate, alters blood pressure, increases fatigue. If energy improves significantly with proper hydration, that is data. Hydration status is one of the simplest kidney support variables, yet it's often ignored. The kidneys regulate blood pressure, and high blood pressure damages kidneys. This is a two-way system. Early kidney stress may contribute to slight blood pressure increases. Head pressure, subtle fluid retention, again, gradual, which is why routine monitoring matters. Chronic low-grade inflammation affects both liver and kidneys. Inflammatory cytokines alter vascular tone, endothelial function, microcirculation, filtration efficiency. You don't feel cytokines. You feel brain fog, fatigue, mild swelling, reduced resilience. Inflammation is often the common thread. During sleep, the liver processes metabolic waste. The kidneys regulate fluid balance. Hormonal rhythms reset. Chronic sleep deprivation disrupt insulin regulation, cortisol patterns, detox efficiency. If sleep is poor for months or years, Filtration systems gradually strain. Sleep disturbance is often both cause and signal. High blood sugar damages both liver and kidneys. Even early insulin resistance can increase liver fat, increase kidney pressure, promote inflammation. Early signs of blood sugar instability include energy crashes after meals, sugar cravings, increased thirst, frequent urination. These are metabolic whispers. And the liver and kidneys are often involved. Once per week, ask 1. Has my energy been stable? 2. Have I noticed swelling or fluid changes? 3. Has digestion felt heavier? 4. Is my sleep restorative? No diagnosis, just awareness. The earlier baseline shifts are recognized, the easier recalibration becomes. The good news? Both liver and kidneys respond well to early intervention. Key supportive habits include consistent hydration, reducing ultra-processed foods, stabilizing blood sugar, moderate physical activity, adequate sleep, managing alcohol intake, stress reduction. Even small improvements in insulin sensitivity dramatically reduce organ load. The body is remarkably forgiving when given time. Subtle signs become important when swelling persists, fatigue worsens, urination patterns change significantly, jaundice appears, pain intensifies, blood pressure rises consistently. Routine lab work can detect early shifts. Listening does not replace testing. It complements it. Liver disease and kidney disease often take years to develop, which means there is a long window of opportunity. During that window, fat accumulates gradually, filtration efficiency declines slowly, inflammation builds quietly, and most people feel just a little tired. That is the whisper phase. Your liver and kidneys do not demand attention. They work silently until they can't compensate anymore. Persistent fatigue, mild swelling, digestive heaviness, fluid shifts. These are not inconveniences. They are information. Health is not about waiting for alarms. It is about listening to whispers. The silent filters are always working for you. The question is, are you supporting them? This is Health Reimagined. Your body is communicating. Learn the language, and you change the future.